Hey there, if you're a veteran who's been diagnosed with ALS, you are in exactly the right place. We're going to break down how to secure the maximum financial benefits you have absolutely earned through your service. Okay, let's get right into it.
Look, we know you're on a tough road, and we're here to help you navigate it. This isn't about charity. This is about claiming the powerful support system that is yours by right.
So let's kick things off with some really good news. The VA automatically grants veterans with ALS a 100% disability rating. For 2025, that's a solid tax-free foundation of over $3,700 a month. But trust me, that's just the start.
All right, so here's our game plan. First, we'll cover that automatic rating. Then we'll get into the real game changer, SMC. After that, we'll explore the full toolkit of grants and then finish up with how to avoid billing errors and just overcome any hurdles that get in your way. Okay, first up, Section 1, your automatic 100% rating. Think of this as the solid ground you're building on. It's the critical first step. But, and this is super important, it's not where you stop. The great thing is, getting this is pretty straightforward. If you have an ALS diagnosis and you served at least 90 continuous days on active duty, you qualify. That's it. The VA just presumes it's service-connected. And, hey, don't forget to add your dependents, like a spouse, because that'll bump up the payment. You can even get the claim expedited if you need to. Okay, now let's build on that foundation. Welcome to Section 2. And this is what we call the SMC game changer. We're talking about special monthly compensation, and it's probably the single biggest and most often missed benefit that you can get.
So what exactly is SMC? Well, it's an extra tax-free payment for the severe impairments that unfortunately come with ALS. The most crucial part is this. It's paid on top of your 100% rating. But the key thing to know is that it is not automatic. You have to apply for it.
And just look at these numbers. I mean, the potential here is staggering. As the disease progresses, you can move into higher and higher tiers. Look at SMCL. If you just need aid and attendance, that can boost your monthly income by over $4,000. And as you can see, for later stages, it can go up over $9,000 a month. That's huge.
And listen, this isn't just some number on a chart. This is a real story. A veteran got help from a VSO who helped them clarify their eligibility, and bam, they added an extra $4,000 a month to their income. That's life-changing money that helps cover the very real costs of care.
Okay, so you're probably asking, how do I get this? Well, here are the steps. Apply early, as soon as you have symptoms. You've got to provide detailed medical records. If for some reason you get denied, you have to appeal within a year. But the single most important step is this one right here. Work with a Veterans Service Officer, a VSO. Think of them as your expert guides through this whole complicated system, and they are totally free. They know this stuff inside and out and will make sure you get it right. All right, let's keep going. In Section 3, we're going to talk about the full VA toolkit, because it's not just about monthly checks. The VA has some amazing grants and programs designed to really improve your quality of life and support your family. First up is a big one, a really big one. The Specially Adapted Housing Grant. We're talking over $100,000, tax-free, to do major modifications to your house, like adding ramps, widening your doorways, or even putting in an elevator.
Next up, let's talk about getting around. The VA has a one-time grant of almost $25,000 to help you buy a wheelchair-accessible vehicle. This can be a huge boost for staying independent.
And you know, the VA gets that your family is a huge part of your support system. Through their caregiver program, your primary caregiver can get a monthly stipend up to $2,500 a month, plus training and other support.
And this is so important. The support doesn't stop with you. Your family can get benefits too. There's something called DIC, which is a monthly payment for your surviving spouse. Now, here's a pro tip. You can actually pre-file for this stuff now so that when the time comes, the support is seamless for your family. Okay, Section 4. This is a really practical one. How to prevent those costly, stressful billing errors. You fought for these benefits, now we need to make sure you can protect them from administrative headaches. And if you're wondering why this matters so much, just look at this. Imagine getting a bill for $43,000 for care you know is covered. This actually happened. It was waived in the end, but who needs that kind of stress? It's totally avoidable. So how do you make sure that doesn't happen to you? Here's your checklist. First, check your VA health profile and make sure it says 100%. That gets rid of copays. Always get pre-authorization for any care outside the VA. And review every single explanation of benefits, every EOB. If you see something wrong, dispute it right away. And what do you do when you're in doubt? You guessed it.
That's right. You call your VSO. They're not just for applications. They can get on the phone with the VA's billing office for you and fight to get those errors fixed. They're your advocate. All right, we're in the home stretch now. Section 5 is all about overcoming those common hurdles. Think of this as your mission plan for success, laying out the challenges and, more importantly, the solutions. I love this because it lays it all out so clearly. Feeling overwhelmed by the paperwork? That's what a VSO is for. Not sure what you're even eligible for? Educate yourself with guides from the VA and groups like Paralyzed Veterans of America. Worried about living in a rural area? Use virtual appointments. For every problem, there is a solution. Okay, we've covered a ton of ground, so let's do a quick recap of the most important things to remember. Your 100% rating, that's just the starting line. SMC is the absolute game changer. The grants for your house, your car, and your caregiver are massive. Always check your bills, and most of all, your VSO is your #1 partner in all of this. So I want to leave you with this final thought. Your journey with ALS is a challenge, there's no doubt about it. But getting the financial support you need and deserve, that shouldn't have to be another battle. So what's the first step you're going to take today to claim what you have so honorably earned?